what was the basic premise of the Grossman model?
Healthcare is two types of goods.
So the Grossman model was looking at healthcare or health stock? Health, right? So now you have to be a little careful about using health and healthcare, because now they are not kind of interchangeable in this chapter, right? So now we are looking at health, the stock of health, and then we are looking at healthcare, and we said that you can look at health or the stock of health as two kinds of goods, a consumption good, and it is consumption good in the sense that you demand more stock of health. There is a utility that is attached from a higher stock of health, right, because you feel better and you can earn higher potential income from better health, and you can make more wealth over your lifetime if you have a better stock of health, and also there is less number of sick days. That is the consumption aspect, but also there is health stock, which is viewed as an investment good or a capital good, and it is capital good in the sense that you can use certain inputs, and these inputs could be healthcare goods, right, and it could be better exercise, better lifestyle, better attitude and things like that, which will give you a improved stock of health, and this stock of health depreciates over time. So it behaves like any other investment good or capital good, which can be improved with more inputs and which can depreciate over time. For instance, in the case of health with age, as you age, it is going to depreciate. Is everyone clear about that part? Do you have any questions? So now we are going to concentrate more on that second aspect that we talked about last time, and it's kind of very easy for you to, especially for people who are from non-econ background and who are never going to, deal with economics directly ever in their life. At this stage, it is kind of easy for you to kind of question and say, why are we even sitting in this class? And at every point during this semester, you are going to question, you're going to have that question that why is this even a required course and why do we need to sit through this boring stuff? Because we are going to be hands-on people, we are never going to need this. But you must understand that although you are going to do things hands-on, there is a theory that is backing the stuff that you're doing, and there is a theory that is backing whatever service you're delivering. There's a reason as to why people come to you, why people seek your services, and unless you have a feel for that theory, it is very difficult for you to appreciate what you do and why people, why are you important parts of the society, why are you important as healthcare professionals. So now we are kind of talking about the stock of health, which I'm writing as capital H, and I'm saying that this stock of health can be produced or improved. It can be improved because everybody is born with an initial stock of health. So it can be improved using inputs, and one of these inputs is healthcare. And if you look at the lecture note 5, I think on page 2 of the lecture note 5 or page 1, I don't remember, it's page 2 I guess, there is a picture, there is a diagrammatic representation which says inputs, and then there is the stock of health, and then there is the output, right. There is a diagram which tells you what is the linkage. But now in economics, whenever we use certain inputs to produce something, that is called a production model. It's called a production model. And a production model, in very simple terms, it just means that some inputs, some combination of inputs are used to produce a certain output. So in that sense, the Grossman model is a production model, because you are combining certain inputs like healthcare services, and you are producing a certain output. That's the output is the stock of health. Okay? Now, when we make a diagrammatic representation, now we can make a diagrammatic representation of this production model, and that is exactly what we are going to do right now. So now on the two axes, we are going to have the output, which is the stock of health. So that's the output of the model, the capital H that we were talking about. And here I have the cost of the inputs. So basically here I am talking about the cost of investing on healthcare. In the textbook that may be given as, I am not sure what is written exactly, that may be written as investment. But it is investment in the sense how much money or how much time are you putting on getting medical care, getting health care. Okay? So it is basically the cost of inputs, or in other words it is the cost of health care. But I want to remind you that health care is just one input here. There could be other inputs, right, like diet, exercise and things like that. Healthcare is just one aspect of the inputs, but we are concentrating on healthcare, right. Now you can understand that here, so you know, if I kind of look at the two axes, if I concentrate on this, logically if you think about it, if someone has a low stock of health, would his investment or would his cost of inputs be high or low? What does a low stock of health mean? Does that mean the person is healthy or no? No, right? Low stock of health. So would he need high investment or low investment? High investment, right? So that would be somewhere here on that axis. As the health stock gets better, investment should go down, isn't it? Or in other words, what am I trying to say? I am trying to say that for a low stock of health, you have maximum benefit from high investment in healthcare. Please write that down. For a low stock of health,
meaning poor health.
Poor health, yes. From a low stock of health or poor health, you have maximum benefit from high investment in healthcare. What did I say? For a low stock of health, that is poor health, you have maximum benefit from a high investment in healthcare, right? Now, if your health stock improves, if the health stock gets better, where H2 is greater than H1, H3 is greater than H2, if your health stock improves, then that benefit gradually reduces over time, right? So, what I am trying to say is, let us say, you know, I have cancer, so I am in extremely poor health. Right now, radiation treatment or chemotherapy will be of maximum use to me, it will be of maximum benefit. After I have gone through the first round of treatment, my disease is probably somewhat brought under control. So, for the second round of treatment, I still have benefit from it, but the benefit of the second round of treatment is going down. Now, does that concept sound similar to you? You have seen that? You have heard about that? So, what are we talking about? We are talking about diminishing marginal benefit, or we are talking about diminishing marginal returns, isn't it? So, that means health or health care is just like any other good, any other consumption good. For healthcare, you also have diminishing marginal benefit. That means if I draw the marginal benefit curve for healthcare, that is going to be a downward sloping line. And that's same like the bottles of water example that I gave you when we were doing, you know, marginal benefit and marginal cost. When you are extremely thirsty, that bottle of water has maximum benefit for you. As your thirst gets quenched, the benefit of a bottle of water reduces for you every time. Similarly, for health care, if you have a low stock of health, you will demand maximum health care and you will be willing to put out maximum money for health care. As your health improves, your benefit is reduced and hence you are not willing to shell out as much money and as much resources for your healthcare needs. Okay? Now, this downward sloping line that we have here, you could simply call it the marginal benefit curve for healthcare. You could just call it that. Okay? But you know, we like complicating things as economists, so we would just give it a technical name and call it the marginal efficiency of investment or MEI curve. But conceptually, it's just talking about the marginal benefit of healthcare. So we are basically referring to what is the marginal benefit, or in other words, what is the benefit that I get from every additional dollar or every additional resource that I spend on this input that is healthcare. That is what is the definition of marginal, right? Remember, marginal is 1 unit at a time. In other words, what I am trying to say is marginal efficiency of investment or marginal efficiency of the input that I am talking about, that is basically what is the addition to the output. In this case, the output is your health stock, that is capital H, for every additional unit of the input, where your input is the health care. Okay? So that's what we are looking at. What is the addition? And now when I am talking about addition, of course we are talking about what is the additional benefit. So what is addition to healthcare means, this entire thing, addition to health output, that means it's a benefit, isn't it? So in that sense, it is what is the marginal benefit that I get from every additional unit of resource spent on healthcare goods. That's why as a if you consider, so you guys are here, you are on the y-axis of things, right? As a healthcare provider, you are on the y-axis, you are being measured on the y-axis. So what do you think? Who are people to whom will you be of maximum value? People who are really sick, people who are in extremely difficult health condition, and that is exactly what you see in your work field, right? You will be probably, if you are working as a consultant, maybe if you do not have a full-time job, but you are, you work for different hospitals, and I know a lot of physicians, do that. I'm not sure if that happens in your field. Maybe, you are attached to several hospitals. If there is a real critical care patient who needs a surgery, and that person needs a qualified anesthesiologist, you will get maximum money if you go there, because the need for that person needs you the most. So that was just 2 cents to kind of get you rid, I don't know if that helps, but to kind of help you in your frustration of why you are studying economics. You're not going to use it every day, but doesn't hurt to know. Okay. Now, so this was the most simplistic thing, this was the most simple, outlook towards it, that okay, fine, you have health stock, and when you have a low health stock, then you should put in maximum resources towards your health care and all of that, right? But so we were talking about the benefit, but please note that we are not just measuring the benefit of the investment in healthcare here. We are not just measuring how much will I get, how much will my health stock improve by investing on healthcare, but there is a direct cost attached to it, isn't it? There is something going in. It's not coming free. When you are consuming healthcare as a patient, if somebody is consuming healthcare, that is not a free good. He has to put in something. So what is that something? Besides the MEI curve, what is measured? So the MEI curve is the benefit side of things. But there should be a cost side of things also, right? What is that cost side? Now the cost side has 2 parameters or 2 dimensions. One is the opportunity cost, which is denoted by R. What do I mean by opportunity cost? If you are unhealthy, if you have a low stock of health, then you lose out on time, you have more sick days, and you are giving up something. If you lie on bed, you are essentially giving up income, right? Or you are giving up time which could have been productively used in something else. So that's the cost aspect of being unhealthy, correct? So that's the opportunity cost that goes into cost. Besides that, your health stock over time, everything else staying constant, it also depreciates. If you do not consume any health care at all, you just get older and older. Over time, your health stock depreciates. So there is a depreciation aspect of which is also the cost. Anything negative is cost, right? Anything positive is benefit in economics. So these are the two negative aspects that are attached to healthcare, if you think about it. Delta, sorry. Delta. You can call it anything, A, B, C, D. I'm just going by the same denotation as your textbook. I mean the lecture notes that I posted. Why am I not saying there is a dollar value attached to it? Why am I not saying that? That would have been the easiest, right? I would have said, okay, healthcare and there's a dollar money, you put in $2,000, $3,000 or whatever.
Because it helps if you're stuck and health doesn't have a dollar sign?
It does, right? So if I say your healthcare is you are investing on, let's say, going to a doctor, that's one healthcare good. You are investing on, let's say, buying medicines, and you are investing on some kind of therapy, some kind of physical therapy. So you are investing on three kinds of healthcare goods, right? And there will be dollar signs attached to all three. But why are we not taking that dollar sign? Further back, go back to day 1, lecture note 1. What did we say? In economics, we are bothered about not just explicit cost, but the implicit cost. We are bothered about opportunity cost, and that kind of sets us apart from accountants, right? So we do not just attach ourselves to dollars, but we look beneath the dollars. Because accountants would just look at how many dollars go out of your pocket. Let's say this month you went for office visits 2 times, you filled in prescription 2 times, and you went for a therapy 2 times. An accountant would just add them up and say that is your cost. But what about the time, the 10 days you lay in bed, and the 10 days of income that you probably gave up, right? And what about the, before those 10 days, if you were sick for another 10 days, what about the depreciation that your health has taken? What about the decrease, the disimprovement in your health stock that has taken place in all those 20 days? That's also a cost to you. That's a disutility, that's a negative thing for you. So who takes care of that, right? And all of that is important because please note, because ultimately all of that is going to impact your stream of income, the money that you could have earned and the money that you're eventually going to earn. Instead of 30 days, if you are able to work only for the last 10 days of the month, then that impacts your income. Thankfully, not many of us are, daily wage workers. We have a salaried income and we have sick days accrual and things like that, but there are a lot of people in this country who work on that basis, right, on a daily basis or on an hourly basis. So any lost time on account of ill health is a cost to them, and any depreciation or any disimprovement of health because of whatever illness is also a cost to them. It's also a negative thing for them. Okay? Is that clear? So we are not tying ourselves to the dollar value. Instead, we are tying ourselves to the more implicit aspects of cost, which is the opportunity cost of time lost due to ill health and the depreciation. Okay? So on one hand, you have the benefit which is coming from the additional healthiness that you can get by spending 1 extra unit of resources in healthcare, right? Now you know the optimal, and please draw this again, this has become messy. We're going to draw the same diagram again. So healthcare, we are measuring both benefits and cost on the y-axis, and we are just measuring the stock on the x-axis. So we are measuring the output on the x-axis, and we are measuring the benefits and costs of healthcare on the y-axis. Okay. Now, so you have that same downward sloping curve which represents the benefit side. Now there must be a cost side also, whatever, some amount cost, and that cost would be, and it could be anywhere, you know, there or here depending on how much is going out, but there will be some critical value r plus delta. There are two parameters to that, and that will be at a certain level. That's a fixed amount, right? Now you know from your lecture note 1 or whatever, day 1 or day 2, I don't remember, what is the optimality condition for any decision making? The optimality condition for any decision making, marginal benefit is equal to marginal cost, isn't it? That is the critical point for any decision making. If MB is greater, you end up taking the decision. If MC is greater, you do not take the decision. As long as the two are equal, you kind of are at an optimal point, at a happy point in your decision, right? Where is that point? Here. The intersection of those two curves, because the MEI curve is representing your marginal benefit and your marginal cost is being given by that r plus delta, because your cost has those two parameters, correct? So that
That's called your what equilibrium?
that's the optimality point, the optimal decision making point. And corresponding to that point, whatever is the stock of health, that is called your optimal stock of health, and let me call that H star. What does that mean? That means given that you want a certain amount of healthiness, a certain amount of benefit that you have attached to healthiness, and given a certain amount of cost that you have laid out for health care, H star is the health stock that you are going to have. That is true for any of us? Any of us? If I think that, okay, having diabetes is okay for me, you know, it's just a condition, and since I have diabetes, I have to take insulin every day, so that's my healthcare input. By taking insulin, I can maintain a normal level of diabetes, so I still have a chronic condition, right? But I can manage that chronic condition by laying out some investment or laying out some resources on healthcare, then that is my optimal condition H star. Now someone may think that, you know, diabetes is bad for me and I don't want diabetes at all, I want to be cured. Now I don't know if diabetes can be cured at all, I believe it cannot be, it can be managed but not cured. So someone thinks that, okay, let's say some other disease, but that one person does not want to manage it but wants to get cured, absolutely, right? Then that person would probably have to lay out more money, or that person will have a health stock that is somewhere there, wants to have a target health stock that is higher, right? So what am I trying to say? I am trying to say that this is specific, this optimality condition, these curves that we are drawing and that line that we are drawing, it's specific to every individual. It is not the same for everyone. If I have a low stock of health, it depends on my perspective, how I view it. I may be having a low stock of health, and hence I may be wanting to put in more investment in healthcare. You may be having a higher stock of health, and hence you may be willing to spend less resources on healthcare, or we may be having the same level of health stock and wanting to have the same target level of health and yet not willing to spend the same amount. Or on the other side, we are spending the same amount on healthcare and yet have very different results in terms of health stock. So all those possibilities are there. So it just depends on how an individual is looking at health and how an individual is looking at healthcare. It just depends on the perspective and the attitude of the individual. Okay? Do you see what I am saying? Yes.
So let's say that this opportunity cost and depreciation of health that we're currently at, that gives me the optimal condition of health. Let's say I want to have more input. Wouldn't it decrease where the H is on that curve?
That is where we are heading towards
Okay.
after this. Okay? That what is going to take this up or down, or what is going to change those levels. Okay. So, there could be different things that change that level, okay. But we are going to look at a couple of things. We are going to talk about the most common things that change that level. First, let us talk about depreciation, first let us talk about age. So, we are going to talk about age, education, wages, wealth, and there could be host of other different things, okay. Because what did we just say? We said that that optimal point, that H star, depends on those curves, and those curves depend on my perspective, how I am as an individual, or who I am as an individual, and who I am and what I am as an individual may depend on these things. A person 60-year-old is different from a person who is 20-year-old. A person with a PhD degree will not be the same as a person who is a school dropout, high school dropout. A person who has a wage rate of $150 per hour is not the same as a person who has a wage rate of $10 per hour, right? A person who has a lot of wealth, inherited or otherwise, it's not the same as a person who is homeless, correct? So, that kind of sets these things, these are the most basic things which set one individual apart from another individual, and hence affects their perspective, and hence affects their ways in which they would view health stock, and the ways in which they are going to use those inputs for improving their health stock, right. So, let us see how are these things going to affect. Now, if we talk about age, what do you think it affects? Among all these things that you have on the board, which one do you think it affects? If you have higher, if your age increases, an increase in age, but what is it affecting? Which parameter? Why is it affecting the cost side? Correct. So, basically it is the depreciation. So, if your age increases, and please note we are talking about an increase in age ceteris paribus, that means everything else remaining the same. If we are just talking about an increase in age, that means you have a higher depreciation, isn't it? Everything else staying the same, no other change. If you are just an elderly person, then compared to a younger person, the depreciation aspect of your health has been higher. If the depreciation aspect has been higher, then the R plus delta dash will be higher than R plus delta. Is that correct? So, can I say then for a elderly person, compared to this guy, compared to what we have on the board, his cost line would be there, because now it is R plus delta dash, where delta dash is greater, a positive number which is greater, isn't it? So, what does that mean? For an elderly person with no other change in the system, with everything else staying the same, the health stock of an elderly person is lower. Do you see? And this is a very simplistic thing that we are talking about. This model is a very simple depiction. In the real world, there could be 10,000 other things that are interjecting, right? And hence things might get complicated. But everything you cannot capture in a model, and that's kind of the shortcoming of economics, that we kind of take it one model at a time, which can only address one thing at a time. We cannot kind of include and analyze everything at the same time. But basically, that is what it means, right? Now, education. What do you think? What about education? So, for age, it's a very direct, straightforward result. What about education? What do you think education can impact? If I am an educated person, what do you think?
Probably have healthier habits.
First, exactly. So, what did Courtney say? She said if you are an educated person, you are probably managing yourself, you are probably more efficient in using what is available to you, right? So, you are probably more aware, you probably know what are the benefits of being healthy, and hence maybe you are using more preventive care, right? And hence, that means you are aware about the marginal benefits. You are aware about the higher marginal benefits of healthcare. So I am drawing it in the same diagram. You can draw it in the same diagram, or you can put it in another diagram, whatever suits you. But take it down because it is not given in this detail in your printed lecture note. So now, in terms of education, this could mean that you have higher marginal benefits. You realize that there are higher marginal benefits from using healthcare, or you can use healthcare more efficiently. So you can have a marginal efficiency of investment curve which is higher, correct? And if you are that kind of a person who realizes, who is able to efficiently, this just means you are using the healthcare more efficiently, right? You are having additional benefits from every resource that you spend on, every unit resource that you spend on healthcare. You are an educated person, so you are able to use what is available to you more efficiently, right? And everything else staying the same, that would mean that you have a higher health stock. Do you see? Yes? But please note that education not only affects this, but education could also affect that opportunity cost. Why? Because if I am an educated person, I am probably employed in a much better job, and the cost of the sacrifice that I put in for being unhealthy, that is probably higher than somebody who is not as educated as me. The foregone income, my foregone income is probably higher than the foregone income of somebody who is less educated than me. My hourly pay is probably higher. My cost of my time is probably more than somebody who is not as educated as me. That is usually true. Do you see what I am saying? Once you go out with this degree, you will be more educated than somebody else who does not have than a regular nurse probably, right? By the virtue of this education, you will be better qualitatively than a regular nurse at a clinic. And hence, just because of this education, the opportunity cost of your time will be much more than a regular nurse. If you stay home for 2 days, what you give up is going to be much more than somebody who does not have the same terminal degree as you. Do you see what I am saying? So that means here it is not just about a higher MEI curve, but it could also mean it is a higher opportunity cost where, so MEI higher, or it could mean R dash is higher for education. It means for education you do not have a certain effect, instead you have an ambiguous effect. It is uncertain. It can go either way based on which aspect is weighing more, right? And also notice another thing in the same diagram. What if we said that there are both aspects to it? Instead of this being or, what if I said that there are both aspects? It's and. This is true. What would that mean? That would mean this is higher and that has also moved out. So now my optimality point is the intersection of those two new curves or lines, whatever, the R dash plus delta line and the MEI dash line, because now that is and, like Josh was saying, right? Even then, what is your health stock? That is your health stock. Let's call that H3. Please note that H3 is higher than H2, but it is lower than H1, so it's somewhere midway. So that means you really don't know, you really cannot say for certain. If you weigh with the or situation, if you weigh the and situation with the or situation, you don't know where this H3 is going to actually lie. That H3 could be more towards H1, it could be there depending on where those curves are set. That basically tells you that it is an ambiguous effect. Education has an ambiguous effect. It just depends on country to country, population to population, perspectives to perspective. Okay? Now, the next one is wage rate. You probably want me to use another pen. Okay. Now, I have wage. Even for wage, you have the same thing as education. You pretty much have the same impact as education, because also income in a certain way, it is similar to education, because if you have more income, you may be able to use healthcare more efficiently, like using preventive care, using things like meditation, yoga, go taking classes, going for more fitness classes, swimming, eating better food, organic food and stuff like that. So, you are just able to more efficiently use the inputs, healthcare and otherwise, right. So, your MEI dash curve may be on the right, just like education. I am not drawing that, but please put that down if you want to draw that or write that down. So, either your MEI dash curve could be like that, or direct effect, you can have a higher opportunity cost because you earn more wages. So, if you stay home, you give up more in terms of dollars. So, either that can happen or this can happen, everything else staying the same. Just like education, it is the same thing.
So what's the difference?
No difference, just two aspects. The trigger is the difference. The cause is different. One is wage, the other is education. Okay. But here, in case of wage, the possibility of or is less than the possibility of and. And is a more plausible situation for wages, because if you earn higher wages, it is in dollar terms. So, if you have more dollars, you will be able to kind of use better health care, and you will be able to use better inputs and use those inputs more efficiently. But since you are earning that higher income, it is not a matter of perspective, but that income means more opportunity cost. So, two things happen at the same time, and that and, the possibility of and happening, you understand what I mean by and happening, right? The two things happening at the same time, the possibility of that is more than in case of education. In case of education, it could be one way or the other. I could be an educated person, and hence I could be using the healthcare inputs more efficiently, but I do not want to work. I am a lazy educated person, right. So, then my opportunity cost, it is not necessary that my opportunity cost will be higher than an uneducated person who is employed, right. So, education puts me on an either or situation more often. But wages is something direct. If you have higher wages, you probably are more capable of efficiently managing the inputs. And since you have higher wages, you definitely have a higher opportunity cost than a person who has lower wages, right. So, that means for wages, you are in a situation like this, where you have a new optimality point and a higher health stock. So, the ambiguity, the possibility of ambiguity is there in case of higher wages, but the possibility of ambiguity is less than in the case of education, to answer your question. Okay. So, theoretically you may have an ambiguous effect, theoretically you may have this or you may have that, okay. But practically the possibility of having both together is more than in the case of education. Will you be able to explain this if I give you a subjective question on this, education and wealth? Why not? Write it out at home, practice. When you are studying, write it out. Because those are the kind of questions, when we review questions, those are the kind of questions you will get. In the Grossman model, explain how wages, increase in wages and higher education may impact the health stock. So you will have to say, you have to explain all those cases that we just spoke about. Okay? Now what about wealth? How do you think will wealth impact? I am a wealthy person. Louder. Wealth is not a flow concept, it's a stock concept in the meaning that I have it. It's not a stream, it's not coming in, it's there. That's the difference between income and wealth. Income is a flow, wealth is a stock. So for wealth, that opportunity cost aspect is not there, because like I said, the difference between wages and wealth, the difference between income and wealth is, one is a stock concept, wealth is what you have. I could be earning zero income, yet I could be a wealthy person because of what I have inherited, right? Or I could have 5 houses and have zero income. I am still a wealthy person, housing wealth. Do you see what I am saying? So what do you think about wealth? What can it affect? So can it affect depreciation? Probably not, right? Wearing out of your health stock? Probably no. If you have 5 houses, not really.
I mean, if you're wealthy enough, you can sleep in one of those hyperbaric chambers.
Yes, say what?
Health would probably be improved.
You sleep in what? Sleep in what?
Hyperbaric chamber.
What is that? Okay, so what is that? What is that? Is that depreciation? It is. It is.
So your health would depreciate as fast.
I mean, I agree it's wealth. But how, where does it feature in this model? Whatever you're saying, that oxygen chamber or whatever, where is it? You are wealthy and hence you can afford that, right? So what is that oxygen chamber? Where is it in this model? Is it on the input side? Is it on the health stock side? Is it the wealth?
That would cost you more input.
So since you are wealthy, hence you can get some inputs. A non-wealthy person cannot afford that. So that's an input. That's not the stock, that's not the wealth, but because you are wealthy, that's...
You're reducing the amount of depreciation.
No, depreciation is not that. Depreciation is exhaustion. It's the wearing out of your health stock. That means just because you are healthy or just because you have an oxygen chamber, okay, do you say that I am in excellent health than somebody who does not have an oxygen chamber? That is depreciation or no depreciation. But that oxygen chamber itself is not depreciation, it's an input. You use that to improve your health stock.
Yeah, I get that. But so your health stock would be better than the person that can't afford it.
Correct, but that's not due to depreciation or no depreciation. Depreciation is not involved there. Depreciation is something like you had an accident and I did not have an accident. Because of the accident, your health has become bad than mine. So your health has depreciated because of the accident. It's something exogenous. Or you are older than me and hence you don't feel as healthy as me. So that has age has depreciated your health. Okay, but here you have something, you are using something like your oxygen chamber, and hence you are improving your health stock. And you were able to get that oxygen chamber because you are wealthy than me. So you are able to use more inputs. So that oxygen chamber is an input. So how would that feature here?
So the depreciation will not change, you're saying?
In this case, in your example.
Okay.
In your example. So what would that look like here? If you can buy more inputs, if you can get better inputs, marginal efficiency of the input, is that going to be higher? Isn't it? So that way it's going to be on the right hand side, right? For a wealthy person, can the marginal efficiency of investment or the marginal efficiency of the input, can that be on the left hand side also? Can you think of something?
What's that question again?
Can, for a healthy person, for a wealthy person, a person who has wealth, can the MEI dash be lower? Can it be on the left hand side? Can you think of, huh?
Maybe if they overindulge or
If you eat steak every day, party life.
Go back to the definition of MEI. MEI is how much is an input, an additional unit of input, how much is that able to deliver to me in terms of my health.
They're not investing much into their health.
So it could go up.
So what I'm trying to say is it's that same oxygen chamber, okay. Someone is investing on that oxygen chamber because he is wealthy, and hence he feels that that oxygen chamber improves his health stock. Possible? In that case, MEI dash will be to the right. Now what I'm trying to say, that is it possible that a wealthy person has to use less inputs, ends up using less inputs, and hence has a lower health stock, or uses inputs in such a way that his health stock decreases?
he runs out of this well?
No, no, no.
Get Botox in your face every day.
Like somebody was saying, I was hearing something.
Well, you're not gonna get it, you're not gonna spend money on something that's gonna depreciate your health, so it can't go up.
Like cocaine, or like, like celebrities and stuff that use drugs.
Well, that's increasing it when they're using it, because that's making them feel better inside.
No, what I'm trying to say, can I put in money on inputs, but that input is not improving my health? It's not an addition. I'm using inputs, but that input is not helping me. Like someone was saying, you know, like, yeah, like those, you know, the whatever, cosmetic jobs that a lot of people do, that decreases your health stock, right? Lot of wealthy people, especially people in the entertainment business, they abuse their body, right? By doing different kinds of surgeries and silicone implants and this and that. But that is actually, that is bringing down your health stock eventually. You are using more inputs. Think about it.
So like steroids or something if you were a body.
Yes. For facelifting and stuff, you know, for wrinkle removal and things like that, people do all of that. So that kind of over time, you are using more inputs, but that is not improving your health stock. That is bringing down your health stock over time.
Why does it bring it down?
Hmm?
Why does it bring it down?
Because it is not improving your health stock. There are things like this which is bringing down your health stock. Because over time, it's an abuse to your body if you keep indulging in those practices. Something like taking steroids. For some people, men, you know, for building their muscles and stuff, they take steroids. Okay, let's come back here. Let's focus on this. Some people, some men take steroids. Some women, you know, they do a lot of surgeries and things like that for cosmetic reasons. So it is still using more inputs. It's still using more healthcare inputs, but that is not adding to your stock of health. That is not improving your stock of health. That is actually disimproving your stock of health. Or maybe I am a wealthy person, and hence, you know, I can use whatever, I can use things for recreational purposes. I can use input certain, I take drugs just for being high, for hallucinating. So I'm still putting in more of inputs, I'm still using more inputs, but that input is not adding to my stock of health, rather it's taking away from my stock of health over time. So that means we are talking about a movement of the MEI curve to the left, and hence a decrease in the stock of health. So for a wealthy person, once again you can see that it can go both ways. The MEI curve can go both ways. And please keep a note to yourself that in this chapter, it is best for you, if you have a question on this chapter, it is the best for you to explain in terms of real life examples, rather than just writing out stuff, even if it is not asked in the question. It is always better for you to write some real life examples and explain. Okay, that will fetch you more points. Should I stop here or go on?
So anything that doesn't actually improve your H stalk is gonna move your gimme eye.
Let me hear his question. Guys, hold on 1 minute, guys. Yes.